If we've heard it once, we've heard it 1,000 times. Demand far outpaces supply of the COVID-19 vaccine. Means it's hard to get appointments for first doses and for second doses. And that's what we're going to focus on here for the next few minutes. Those second doses that many people are now eligible for thanks to the shots going into people's arms. We have Nola Eigner-Davis from Polk County Public Health joining us now. Nola, should people who have gotten the first dose be concerned about their ability to get the second dose here in Polk County? Let's just make it simple. Yes, no, or maybe.
So we know there are a lot of questions and a lot of concerned residents in Polk County about getting your second dose. Now, according to the CDC guidance, we know that we want people to get their second dose vaccine as close to the second dose date as possible. But we know that there may be delayed, especially with what we're seeing with the weather. There are concerns that vaccine will be delayed. But I think rest assured, and we want to rest assured our community, that all of the evidence that says that even if your second dose is delayed, you will not need to restart your series.
But isn't there still a window? Because we were talking about 28 days is the ideal of getting after the first dose. 28 days later, you get the second dose. You're talking about 42 or 6 weeks. Does there come a point where you got to start the whole thing over with a first dose?
All of our evidence states that you do not need to start the series over again. So even if that, let's say your vaccine, your second vaccine goes longer than that 42-day window, again, we're working our hardest to make sure that everyone is getting that vaccine within that 28-day time frame, But if it does go over, all of our evidence states that there is no need to restart that series over again.
And is it true that there is some degree of protection from the first dose?
Absolutely. After you get your first dose, we know that you have significant protection. We know that once you get that first dose, we see about 10 to 14 days, you have immunity, which means your body is building up antibodies, and that will protect you against the COVID-19 virus. Now, that's not to say for people to say, okay, well, I don't need my second dose. Obviously, you need your second dose to complete a series, so you have the optimal amount of immunity, optimal amount of protection against the virus.
Let's talk about the supply chain really quickly. When the new doses come in each week, are some reserved back for the second dose batch?
So we work with our hospital and our pharmacy partners, and we figure out how much that they have for first dose and how much they have for second dose. And we make sure that we can allocate those numbers to them to make sure they have enough vaccine to vaccinate their community.
Nola, you mentioned how the weather has hamstrung efforts to get, it's actually the Moderna vaccine from Southern distribution centers up here to the Midwest. Any concern about second doses of that particular vaccine, the Moderna vaccine, where people are waiting on that?
So we know due to the weather that Moderna factory again is in down south, and we've seen that the south has been rocked with weather that they've never been hit with before, or not in this time frame, and unfortunately that does affect the Moderna supply. So again, we will see a delay in vaccine.
Okay, do you know to what degree?
We do not know. We don't know until we get an email saying we have vaccine. So again, it all depends on the allocation and how fast that they can get the vaccine shipped. We never really know when we get vaccine until we get an email that lets us know that we have an allocation.
Okay, but to reiterate what was the point of all of this is that people who've gotten the first dose of the Moderna vaccine shouldn't be concerned if they've got to wait past 42 days. They can still get that second dose.
Right, and you will not have to restart the series. All of our evidence shows that you will not have to restart that series.
Nola, thanks so much for coming in and clearing up all of these things. One quick question. With people getting vaccinated and spring break on the horizon, what are your thoughts on traveling?
You know, I think that spring break is often a time for us to go somewhere warm, but the virus doesn't stop where you're going somewhere warm. You know, viruses everywhere in the nation and in the world. So just because you're going somewhere warm and you're going on spring break, again, viruses don't stop working. You need to wear a mask, you need to social distance, you need to wash your hands. Even if you're going on spring break and let's say you got vaccinated, you still need to make smart decisions because your decisions impact the community and the people you love and care about.
Nola Eigner-Davis, thank you so much for taking the time to come on and give us some really straight answers to some pressing questions. Best of luck to you and your team as you try to get more shots and more arms.
Thank you.
All right, we're back with more on the news at 4 right after this.